Hi, Amy.
Hello.
You okay?
I'm not bad, thank you. Are you?
Yeah, not too bad, thank you. I think from some of the messages, I think some colleagues are struggling getting into some of the breakout rooms, so
Right.
hopefully a couple more people will arrive shortly.
No problem. I'll hang fire for a little bit then.
Okie doke, thank you.
No problem. It's been really interesting. Oh, I've not got my hang on. Have I got my mic on or not? Yeah. I dialed in at 9 o'clock and watched some of the other presentations, and they've been really, really interesting. I don't think I'd properly understood what systems leadership actually truly is until we'd watched those presentations. So it's been really it's given me a lot to think about. It's been good.
Yeah, it's good, and good to hear some of the stories as well in terms of, yeah, real life system leadership and practice rather than the theory. So I'm glad you've enjoyed it. That's really helpful to hear. I guess we could start, Amy, whenever you're ready, and I guess will join us.
Sure. Okay. I'm going to do quite a lot of talking to start, so people can come in. I'm just going to share my. Oh, hang on. Just 1 second. Can people see this?
Yes, thank you. Yeah, brilliant.
Yeah. Okay. So because I can't really see who's in the space, and it's just whoever wants to join, I'm going to just assume that people don't really know anything about 100% Digital Leeds, and talk quite a lot to start with, and then I'm basically going to talk about a little bit about digital inclusion and what that looks like, and who's less likely to be included or more likely to be excluded. Then a bit about our approach as a team, and then just touch briefly on some of the really health-focused projects that we've done recently, and then I can see which people are most interested in hearing about, or just take general questions and thoughts, if that's okay. So my name's Amy Head, and I'm a Digital Inclusion Coordinator on the 100% Digital Leeds team. We're a team of 5 people, and we're working across the city. We're a council department working across the city to try and improve digital inclusion and make Leeds the most digitally inclusive city in the country. That's our ambition. So there are 4 main shared and universally established barriers to digital inclusion. And this is taken from a digital inclusion guide for health and social care produced by the NHS, which is available at our website, digitalinclusionleeds.com, alongside other studies and toolkits and things like that that people might find useful. But the 4 established and understood shared barriers are access. So people not literally having the stuff to be able to get online. So that might be not having a device, not having the right device. So having a smartphone when actually a laptop or a tablet would be more convenient. Not having the device that works for them. So if somebody's got disabilities or sensory impairments or something, doesn't have and finds their device very difficult to use. People that don't have Wi-Fi at home or can't access it in the community or have a poor connection, or people that rely on data, expensive data, people that aren't able to get data contracts and so are relying on pay-to-go, which is more expensive, stuff like that. And then levels of connectivity as well. So people that maybe have one smartphone or one tablet for the whole family, which means that not everybody is able to connect when they particularly want to. So that's around access. So skills is around, it's pretty self-explanatory, around not knowing how to use your device, not knowing how to download an app, not knowing how to buy something online, or find your right search results, find accurate information, all of that kind of thing. Confidence is similar but slightly more complicated. That's more around fear of putting your bank details into a website because you think that you're going to get hacked, fear of opening. It's usually around not properly understanding e-safety issues and how people can keep themselves safe, and just hearing little snippets of things that they shouldn't do and things that maybe have got people into trouble, and then fearing doing all of it. So a lot around people not wanting to open an email attachment ever or click on a link ever. Or yeah, the most common one is fear of online banking and stuff like that. And that's just around not knowing how to keep yourself safe and not understanding the risks and the level of risks. And then, and also around more linked to skills, but things around not feeling like they're able to have to develop the skills needed to be able to do things digitally. So people thinking that they're too old, people thinking that they'll just break it if they touch the device, those kinds of things as well. And then the final one, and in some ways the biggest one, is motivation. And that's around not knowing the kinds of things that you can do online, not knowing the variety, and not seeing the relevance to yourself and your personal life. And a lot of the time that tends to be older people, because they've maybe had less experience with being online, so they're not seeing the kind of things that they can do, and they've lived their life without it, in their opinion, very well and very easily. And so why would you bother to try and get over any of these other barriers? And people can have all of these barriers or just one or some of these barriers. And then on top of that, there can be additional barriers and things that are barriers to just everything in general. So this is around having a disability, having a learning disability, having English as an additional language, having sensory impairments, memory loss, sort of cognitive function, anything like that that makes that's an additional barrier to people just being able to access stuff. With this, that barrier on top of one or more of these other barriers, all makes it more difficult for people to be able to access stuff digitally. And it's not a small problem. There are lots and lots of people in the UK that are not able to make the most out of digital. So around 16% of UK adults aren't able to use their device to get online themselves. On top of that, 7% are completely or almost completely offline. So that's just never using any sort of internet at all. And then a much bigger percentage, around 22% of adults UK-wide, don't have the basic digital skills that we all take for granted to be able to do the kinds of things that we do. And that's around things like doing transactions online, communicating with people, being able to fill in a form, those kinds of basic skills. And Leeds is very similar. Those numbers are sort of reflected in Leeds as well. It's really difficult to put an exact number on the people in Leeds because there is no one definition of when somebody is included or excluded, because there's different people can be included to certain levels. So like the idea that somebody may have a smartphone with data but never use any of the smart elements of it, or somebody using Facebook and WhatsApp but not feeling confident enough to be able to manage their universal credit online, or being able to use something like Zoom to do video conferencing, but not being able to use other systems to be able to do other types of video things, like maybe a video appointment or something like that. What we can look at is the indicators, so sort of shared characteristics of people that are more likely to be not an internet user or not making the most of digital in their life. And those indicators are these 6 things here. So the age at which they left full-time education, the presence of children in their home, their literacy levels, their income, their social grade, and their age. So it tends to be that older people are, and the less well off they are, the more likely they are to be digitally excluded. That is a tendency. There are more digitally excluded older people than there are any other category. However, as it says at the bottom here, and this is taken from a report that again is linked to from our website, if you want to go and find out more, and the top statistics are taken from the Lloyd's Digital Consumer Index, which gives a really good overview of digital inclusion nationally each year. So as it says at the bottom here, Age is a big factor, but it's not the main factor. There are lots of older people who are very well educated, who have lots of children, who have got excellent literacy, who are very well off. And those people are almost universally not going to be digitally excluded. And that's because they can afford the stuff, they can fill in a form anywhere, they are very able to learn things, and they've got children and grandchildren that are going to help them to keep up and demand that they interact digitally, because that's the way that younger people tend to be more likely to communicate, especially during the pandemic. The other factors are much more important. So as you can see from here, levels of formal education are really, really important. So you're 4 times more likely to be digitally excluded if you've left education at under 16 years. And that kind of reflects why more older people are excluded as well, because older people, oftentimes, you know, people left school at a younger age. There's maybe not as much emphasis put on schooling, depending on how old people are. Having children in the household makes you more likely to be digitally included. And as I mentioned, that's because of younger people keeping up with stuff, having to learn to be able to support your children, to be able to support them to do homework and things like that. But also because of having younger people around to be able to help the older people to learn those skills. Literacy is a massive factor, and that's around just being literate in general. So if you struggle to fill in a form on paper, then you're going to struggle to fill in it digitally, because writing is a big part of that element. And same with finding trustworthy information. If you struggle to find it in a book, then you're not going to be able to find it online. Earnings is a massive indicator, and that is a lot around both having the money to be able to have the right equipment and the connectivity, but also because higher earning jobs are more likely to demand that somebody has digital skills to be able to do them. So the comparison between a manager in an office and somebody that works on a factory floor or as a cleaner, for example, and also white collar sort of jobs are obviously more likely to offer more digital training opportunities as well, and also more likely to offer free equipment, like I'm using my laptop now, and also use it for personal stuff as well. And then social grade as well. So those are the things that it's most important to be able to look at. There's often this idea of younger people being digital natives because they have been maybe brought up in a world where digital access is more common, or even some might consider universal. But we always compare it to literacy levels and access to books and reading. There are still young people who leave school without being able to read, and it's not because they don't necessarily have the ability to access books and stuff like that. It's because they haven't had the support to be able to read. And there will always be those people, and those are the people that we need to look out for, that might need more help to be able to do things digitally and engage with digital to make their lives more easy. And there are loads of benefits to people being able to do things digitally. And again, this is taken from the Digital Inclusion Guide that the NHS have produced. So lots of benefits to people individually around people being able to be more independent, live their life as they would like to, have the same kind of options when doing stuff and transacting and things like that that we have, being able to save money. It's ironic that it's the most poor people in society can't afford to get online, but being online saves us much more money than it costs us, because of the ability to get cheaper deals and stuff like that. But obviously, if you don't have that initial money to invest in getting Wi-Fi or a device, then you're not going to reap those benefits. Being more employable, lots and lots of different things, being able to connect and feel less lonely and isolated, but particularly around health and well-being, being able to self-manage conditions, being able to understand conditions, being able to access reliable and trustworthy information rather than just turning up to, say, a minor injuries unit or something because you're not sure whether a rash is a thing. Being able to interact with different services, and being able to use self-management tools that mean that you're able to manage your condition more easily. And we're going to talk about some of the ways that we've supported those things as well. So this is why we're wanting to do what we do. So all of this is like a golden thread within all of the council's plans and priorities. And our team exists because of an initial inquiry from the council in 2016, looking at levels of digital exclusion across the city, when there was a lot of discussion of digital by default, or maybe not by default, but moving people into online systems because that's cheaper than doing face-to-face stuff. There's basically somebody realised that if it's only cheaper if people are able to interact with those systems, and actually if people aren't able to and they fall off the ledge, then it becomes much more expensive and difficult to be able to have those interactions and interceptions that bring people back into where we want them to be, and be healthy and happy and not reliant on very expensive interventions. This is my team. So as you can see, we're quite a small team of just 6 people, 4 digital inclusion coordinators, Jason, who's my manager, and then Sarah, who's an admin support. And our role is to work across the city, building capacity, basically. So we don't do any sort of frontline delivery of digital skills or anything like that with citizens at all. What we try and do is take an asset-based, sort of strength-based approach to working with existing networks and organisations, and the people that are on organisations that are already reaching our target audience of adults across the city that are digitally excluded. And the reason for that is that, as I said at the start, there's all these barriers that make it more difficult for people, like learning disabilities, mental health needs and stuff like that. And we, as a team, do not have the understanding or expertise to be able to properly meet the needs of those people. But we recognise that there are organisations that are already extremely knowledgeable and extremely skilled in being able to offer that support, working across the city. They already have a trusted relationship with those people. They're in a great position to be able to understand the needs and to be able to put things in place in a sustainable way, and embed digital inclusion into their day-to-day work in a way that means that that support will be available to people going forward. And so our role as a team is to help the organisations understand digital exclusion and the issues around it, understand why it's important for their service users, understand and trial and look at different ways that they can embed digital support into what they're doing, and remove any barriers that are stopping them from doing that, basically. So connect them up with the skills they need or the resource they need, or have conversations, share knowledge, speak to other people in the council about putting things in place or making things easier for them, or whatever that might be. And just listening to what they need and helping them. And in this way, we have worked with over 200 different organisations or front-facing parts of the council and different sectors to be able to help them to embed digital in a way that's mutually beneficial for them and for society in general. So these are some of the sort of general approaches that we're doing. So these match up with the different barriers that I mentioned at the start. So around skills, we are working with the organisations that, again, I mentioned, that understand how to understand the needs of their service users and client base, and have the skills to be able to help them, and helping them to deliver skills, digital skills support and training in whatever way they would like that to look, in the way that's going to best suit their service users. So that might be classes, that might be really, really light touch kind of motivational encouragement type stuff. It might be peer support, whatever it might be. We're looking to build a network of different types of learning opportunities aimed at different types of people that have different needs, so that everyone, when they are speaking to people that might be digitally excluded and want to develop their skills, can signpost people to that ongoing provision. For the barrier of access, we're looking to create more opportunities for people to be able to get online. So that might be around increasing the amount of free Wi-Fi available in the community through council buildings and community centres, and identifying different funding opportunities from other partners in other sectors that might want to support digital and support, say, different agencies and organisations to be able to get online. We've got an iPad lending scheme that's available for organisations to be able to borrow 4G enabled iPads to be able to trial providing connectivity for their organisation and service users. And that's so that they can trial different approaches, and then they can evaluate and build up a body of evidence as to why they should have something more sustainable in place in terms of connectivity, so that we can then support them to use that to be able to identify funds to do something more long term. We've also done things like trialling providing free Wi-Fi in tower blocks in conjunction with Housing Leeds, and given out over £100,000 in grants to third sector organisations to be able, at the start of COVID, to be able to adapt their delivery to embrace digital so that they could stay connected with their service users whilst having to reduce face-to-face services. And then for the barrier of motivation, we have a digital champions scheme, and that is around training as many people as possible that have a frontline role to be able to understand who is likely to be digitally excluded, how they can have positive conversations around digital to help motivate people to understand how digital might be relevant to them, to understand that they are in a position to be able to learn digital skills, and to signpost them to those skills development opportunities that I mentioned before, to signpost them to different ways that they can improve their connectivity, whether it be free Wi-Fi in the community or different schemes that are gifting devices or low cost Wi-Fi packages, that kind of thing, to be able to also signpost them to different support available when it comes to being able to make their devices more accessible if one of the barriers is them having accessibility needs. And we've trained nearly 2,000 people now across the whole range of sectors to be able to do that and understand that. And it's also a great way to start a conversation around digital inclusion and exclusion, and how that particular team might be able to spot opportunities in their delivery to be able to embed a little bit of digital inclusion support into their day-to-day life as well. And these are some of the things that I've mentioned already, because I forgot this slide was here. The last one that I've not mentioned. So another thing that we're doing is listening to, so it says that building networks and partnerships, but actually we're not building those things. What we're doing is linking different people and different organisations up when they are requesting to be linked, or when they are saying that they need help and want to learn from other people's approaches, because we're really mindful to not actually try and lead too much, because we want everything to be really responsive to the needs of the organisations and their understanding of the people that they support, rather than us trying to put in place what we think is the right approach. also that means that we are not then relied on to continue leading the way in terms of leading networks and things like that. So we've had quite a lot of investment over the last couple of years, and this has come in different increments as we've proven the outcomes of our approaches, and we've taken on different funded projects. So we've been able to expand our team slightly and also expand our equipment and our remit as well. So I'm going to talk about the Dementia Pathfinder project briefly in a little bit, but that allowed us to expand our iPad lending scheme to include voice activated technologies like Amazon Echo, Alexa as well. So these are some of the things that we've done specifically around health and care, because we are working across all sectors, and our idea with everything that we do is that we try and help, as I said, organisations put things into place going forward. So we really don't do anything where we come in, do something and then leave and it stops. And we don't really have any single approach either. We have various tools that we can use, like the tablet lending scheme, the digital champions training, but really we are very hand-holdy as a team, and we listen to the different needs of the organisations and get them to think about needs and opportunities. And then our role is really about facilitation and linking and removing barriers. So I'm going to really quickly go through, oh gosh, we're really running out of time, some of these different things, and hopefully we'll have 5 minutes at the end to do questions.
Amy, don't worry, we've been given an extra 15 minutes, so we've got till quarter past 12.
That's fantastic, thank you. Okay, so these are the things that I'm going to touch on that demonstrate some of our different approaches, and hopefully you'll be able to, it'll bring to life some of the things that I've just been mentioning. So my COPD, so hopefully everyone has heard of my COPD. It is an app through My Health that we've bought a load of, like, I say we, that's the royal we, I've not led this project, so I'm not entirely sure who is paid for this, but there are loads of free licenses for people with COPD to be able to access this app, which is around helping them to better understand their condition, to be more mindful in monitoring their condition and linking up how their condition might have been bettered or worsened in conjunction with external effects, like, that's not the word, but things like levels of pollution or what activities they're doing, whether they're taking the medication, those kinds of things. It's also got lots of different videos on there to help people to be able to understand their condition, but also things like how to take their inhaler correctly and stuff like that, which Rachel, who's been leading on this project, said has been an absolutely massive one. The number of people that have been taking the wrong inhalers or taking their inhalers completely not correctly at all, like not putting their mouth to the inhaler and stuff like that, has just been absolutely wild. And it also allows people to input their monitoring information that gets fed back through to their clinician as well. So this is something that Rachel's been working on for around a year to promote to the different settings that support people with COPD, and helping them to understand that they can allow them to issue the licenses, but also to be able to make sure that that support is available in the community. So she's been to all of the different Breathe Easy groups and got them all using the apps, helped them to signposted them to the different support in their community that they can access in terms of general digital support and inclusion, and then got them all to become digital champions. So they are now the first place that somebody with COPD can be referred to be able to get support with using the app, and to hear positive stories around how the app has benefited those people in the Breathe Easy groups, which is absolutely fantastic. And also connecting with third sector organisations that are in the areas and supporting the particular sort of cohorts of people that are more likely to have COPD, so that they're aware of the app and aware of the different kinds of support that might be needed so that people can get that support to use it wherever they feel most comfortable, wherever they have a trusted relationship with people, and wherever they tend to go in general. The Dementia Pathfinder, so this was part of the NHS Widening Digital Participation project. So this was also another project that my colleague Rachel led around trialling different approaches to using digital to be able to support people with dementia and their carers to just have an easier life, basically. So she went and spoke to and worked with lots of memory cafes, nurses, carers, people with dementia, and just listened to them and listened to how they live their life and what things are difficult about their lives, and help them to understand how technology might be used to be able to overcome some of those difficulties. So here you can see a picture of a lovely lady called Poppy who's got dementia, and her husband, as her carer, was absolutely at wit's end because she's so agitated all of the time. Really, really stressed, really physically agitated, unable to settle, not sleeping, just having a really difficult time, and her husband was extremely stressed and upset about this. And Rachel was able to trial using the Amazon Echo, which is the virtual reality software, to be able to, so Poppy really likes, so there's a lovely mindfulness video on there, and it's all 360 if you've not tried it, and it's really immersive, and it's David Attenborough narrating this walk through the rainforest, and Poppy just absolutely loved it. And her husband was quite skeptical about trying the technology, but he was also at the point where he was happy to try anything to try and make her be less agitated. And there's a video of her putting on this headset, and he was in tears at the improvement that it made to her, because you can just see her physically just relax and calm while she's in this place. And then we were able to, or Rachel rather, was able to lend the couple the equipment to take home and see how adding it into their daily routines and allowing Poppy to use it at those sort of trigger points when her stress was at and anxiety, and that was at its highest, would be able to help the day go more smoothly. And there's a full report again that you can read on our website, and the findings were really, really fantastic for lots of people, not just for Poppy. So supporting care homes and recovery hubs. So Rachel's also been doing a lot of work around, during the pandemic, getting technology into the different care homes and recovery hubs so that people could, the residents in there, could stay connected with their friends and family while they had to stay isolated, which has been really, really successful with allowing them to be able to stay more socially connected, but allowing them to be able to access different services and things like that as well, and has meant that their isolation has been a lot more comfortable for them. But also it's around using those different motivations of why people might want to develop their digital skills. So while somebody is using video to be able to speak to their children and grandchildren, they're getting more confident with being able to use a device, with switching it on, with not feeling like they're going to break it, with trying different things. And Rachel always talks a lot about when supporting people to develop their digital skills, with pairing the known with the unknown. So if people are really nervous around using digital devices, she talks a lot about, and we've got a list of that's been crowdsourced by all of the different organisations that support older people in particular to develop their digital skills in the community. Lots and lots of really simple apps that don't have pop-ups, that don't have sign-ins, that are things that people feel comfortable with, but they're just a digital form. So things like jigsaw apps, things like Sudoku apps, bingo apps, crossword apps, stuff that people enjoy doing in their day-to-day, but in a digital form. And it allows people to be able to stay in their comfort zone and do something that they enjoy whilst learning how to use a touch screen and learning how to use a device and feel more comfortable with it, whilst feeling that they're not really feeling that they are in a digital class or whatever. And it's all part of building up confidence and understanding so that they can then start to do more difficult and complicated things that might be help them to live more independently, especially for people in the recovery hubs that might be going back into living by themselves. We want them to get to a point where they can do their online shopping and can do things virtually. And the final one that I'm going to talk about is, oh no, it's not the final one, sorry, is health hubs. So this is around this project in particular that we got funding for was working with one of the neighbourhood networks, Crossgates and District Good Neighbours, recognising that they've got a great membership of older people locally, that older people, or what outside of a pandemic, spend a lot of time there, know the people, set up a digital champion scheme with for peer learning with older people willing to pass on their skills, which the older learners helped them feel more comfortable and confident, I think, around feeling that the other person that's their peer is going to better understand some of their needs and maybe be more mindful of the fact that they might need things repeating, that they might need to go more slowly, in ways that maybe they worried that a younger person might not have the patience to be able to support. So embedding digital skills stuff and getting them to do digital skills stuff, but then also encouraging the organisation to be able to add a little bit of digital into everything that they were doing, so that people that maybe aren't motivated and don't want to learn to do the digital stuff and maybe are feeling very anxious about embracing digital, start having the opportunity to just be around and just seeing some of the benefits of digital. So things like having an iPad on hand during a coffee morning, so that when the conversation moves, it can be used in the way that you or I would use our phone down the pub, to work out who sang that song or who was in that film or whatever. Just those little things help people to understand some of the ways that digital can be relevant to them and that it's not a scary thing. And then the final part, and the thing that made it particularly digital health hub, was connecting the neighbourhood network with different healthcare providers locally, so that the health hub could understand the types of support that people might need to be able to access those healthcare services using digital. So just knowing how to do online prescriptions, knowing what kind of systems healthcare providers use to be able to do video appointments and things like that, knowing how to set up the NHS app and what number they need to get from the receptionist at the GP surgery or whatever. Making those connections has meant that the community organisation can understand how to best support somebody to access healthcare provision, but also the healthcare providers can then refer and signpost older people back into the third sector organisation to be able to get that support that they need, but making sure that that relationship is ongoing, so that as things change and flex, they're having a conversation, and that support is offered from both sides going forward as well. And it also helps with the social prescribing side of things, because obviously the neighbourhood network offers so much more than just digital support. And the final one, this really is the final one I'm going to talk about now, is the work that we've literally just started in the last month or so with a localised approach to combating digital inclusion in terms of digital exclusion and its impact on increased health inequalities in an area of recognised high levels of digital exclusion. So we are working at the moment with the LCP in Beeston and Middleton in particular to be able to look at different cohorts, how we can identify third sector organisations that might be able to support those people that are struggling to be able to make the most of digital and benefit from all of the different health and well-being benefits that come out of being digitally included. And we're just at the start of that journey, but have I been able to identify some sort of groups of people that are most likely to benefit and different organisations that are keen to be involved. So particularly around the Gypsy Traveller community, around sexual health clinics and sex workers, older people. So how we can learn from the work that we've done in Crossgates with engaging the neighbourhood networks locally to take on more of a digital health hub model, all of that kind of stuff. And as the discussions go forward, we'll look at different opportunities to be able to link people, to be able to resource, and to be able to put some of those networks of opportunities and for support in place that I mentioned at the start. And I think, gosh, we're nearly towards the end, I swear. Right, so these are some of the figures. So yeah, nearly 2,000 champions trained, loads of tablets learned, loads of money into the community, and an initial calculation of return on investment of nearly £800,000, which doesn't sound very much considering all of the money, but a lot of that investment was an initial investment, and those calculations are quite old now as well. We've done a lot of work recently, but during the pandemic our workload has really ramped up, as you know, you can understand, different organisations. So we had to do a lot at the start of motivating organisations to see the relevance of digital inclusion for their service users, just in the same way as you'd have to motivate individuals to see the relevance of digital for their lives. But with a reduction in face-to-face services, that has just become so much more apparent. So we've been absolutely run off our feet. These are some of the different figures that come from that return on investment that show. So basically what we do to calculate that return on investment is ask different learners at different organisations to fill in questionnaires, basically, about if they hadn't have, looking forward and looking back, if they hadn't have done digital things, you know, develop their digital skills and connectivity, how many times would they have had to, do they think, done certain things? So looking at changes in behaviour and then putting a price on each of those interactions, and calculating that return on investment, basically. And as you can see, just around the COPD and people not having to go into A&E or call out an ambulance has been absolutely massive. And we are at the end. So there's my contact details. So do give me an email or follow me on Twitter if you'd like to see more about what we're doing. And there's our website there as well, which you can see details of some of the projects that I've mentioned, as well as some of the support that's available locally in terms of being able to signpost individual learners. So how do I unshare my screen? Stop presenting. So there we go. So sorry, that was a bit of a whistle stop tour through some of our work, in particular pertaining to health. There's lots more that I could have said more generally. We've got about 15 minutes, I think. So does anybody have any questions? I'm aware that we're quite a small group, so I understand if we don't. Or thoughts?
Is the tablet lending scheme still ongoing, Amy? Is that something that's sort of longer term? I know I can obviously see how much benefit it's had. I was just thinking, we were doing some work in Armley, Bramley, Whately and Middleton, and one of the big things that's come up is just people not having kit or data. So people actually do want to get online, but they can't afford to have some of the technology. So
the tablet lending scheme is available all the time, or they're in very high demand. The thing about the tablet lending scheme is that the iPads are available for organisations to learn, not individuals. So those organisations can then learn them to individuals, but the organisation has always got to be, we've always got to have an organisation as a sort of middleman, basically. And that's because that organisation that's borrowed them then commits to making sure that the service users that they're learning them to are able to make the most out of them. And that might be around making sure that they've got the skills, making sure that they've got the motivation, and also helping us to evaluate the impact. And really, rather than being about a long-term solution to providing individuals with connectivity, the purpose of this scheme is to look at what the benefits are to those people having connectivity, so that we can have more of an argument in place to putting something more sustainable in going forward. So for a lot of organisations, that might be about the organisation themselves getting the money to be able to buy their own equipment to learn, or it might be about an organisation getting funding and being able to prove the need for funding to be able to buy data or devices to be able to gift to their service users. And also for us as a project more widely, I mean, one of our sort of blue sky kind of ambitions would be to have free Wi-Fi and devices for everyone in the city, because I think it's such a worthwhile investment because of the level of assuming that everyone's got also supported in terms of skills and motivation to be able to use those. The benefit of people being able to do things digitally and just be more independent and live their lives in the way that they want is something that is proven time and time again. So basically, if you're wanting to learn, or if you are a healthcare provider was wanting to look at temporarily learning equipment to individuals, we would be able to look at learning use some of our iPads that you could use to trial that. But also, particularly around if you're doing work in Middleton, we could feed that into the LCP-led piece of work, which does have, I think, £100,000 worth of funding attached to it. And that is around removing those barriers and resourcing healthcare providers to be able to trial different stuff. So I think that in Middleton in particular, there would be an argument to being able to buy you some of your own stuff to be able to learn, maybe buying some more equipment into the scheme that we provide, because that's got, obviously our iPads are set up in such a way that makes them safe to be able to learn to individuals. So we've got remote management tools on there that means that we can remotely wipe them if they get lost, and we can locate them and block them and all that kinds of things. So they're not like, they have no resale value, and all those are the things that make it safe to be able to learn them in terms of the individual and their data, and not being, they're also, we can filter the data and stuff like that. So there's lots of safety stuff around it, but yeah, that's something that we could definitely look at.
That's brilliant, thank you. I don't know if anybody else has got any questions or reflections for Amy.
I never know whether people are really there when they've just not got their camera on either. Or is everyone nipped to the loo?
Do you know the Digital Champions training, Amy? How long does that take? What's the commitment with that one?
So it's totally free, and we can deliver it to anyone, and it can take around an hour and a half is a good amount of time, and we can deliver it like this on Teams and stuff like that. In fact, I delivered it to one of the 0 to 19 teams yesterday. I believe what would have previously been like health visits and stuff like that. And a big part of that training is around helping them to understand why digital inclusion is an issue, is relevant to them and the people they support. So each of the sessions we tailor to be able to make sure that it properly resonates with the audience. You see the sun's just come out. That's sort of blinded. To tailor so that it resonates with people, so they really understand the relevance to them and why they are there. And also we give a lot of information about how they can signpost people to support and stuff like that. But also it's a great way to make sure that if you're wanting to do more around digital inclusion and you're wanting to work with us to explore what we can all do to be able to improve the digital inclusion of your patients or whatever you might call them, it's a great way to get everybody understanding the issue and bought in to that kind of work. So with the 0 to 19 team, I'm doing about 6 different sessions to get to cover the teams that are working in the area that's covered by the LCP work in Beeston and Middleton. But also there's some similar sort of work happening in the Bermondsofts and Richmond Hill area, so training those staff there as well. And part of it was around having a conversation with those people to get them to start thinking about reflecting on how they have motivated people and recognised digital inclusion and exclusion up to this point, or whether they have at all. So like one of the nurses yesterday was saying, oh, well, I always tell people about digital tools, but I just write down a web address and give it to them and just assume that that's something they're able to access. And you know, that's someone that goes into people's homes, and she was saying that now that she understands about some of the different indicators around that can help people to think about whether somebody might be digitally excluded, that she's going to take, like she would anyway, take notice of how the person, you know, the person's surroundings, the different sort of, try and work out whether they might have some of those indicators, and if they do, be a bit more mindful that they might need more support to be able to access that provision. And then also talking about other opportunities that we might have to be able to trial different approaches to improving digital inclusion. So we talked about possibly looking at implementing or trialing learning tablets to new mothers, because they do a number of visits over a 6-week period, which seems like quite a nice period of time to offer somebody a device and offer them, if they haven't got one, to be able to access some of the digital support that's currently available, and also to be able to monitor whether they're able to access that and whether they can benefit from being signposted to some of the community support in terms of skills and things like that. And that's the kind of sort of pilot in that we're talking about, to help us understand whether it's something that's beneficial and can inform larger projects going forward. So you've asked me how long it takes. An hour and a half is the answer.
Thank you. Really interesting to hear about some of the other things that are going on, and I guess that relationship and trust when staff are working with people is key in terms of it being successful, and really supporting people, coaching them, motivating them to get a bit more involved in digital.
That's it, yeah, and just recognising that need. I mean, I think because a lot of the time it is older people that aren't able to use stuff or don't have the devices or whatever. I think we sort of have a tendency to maybe, when we're talking to older people, not even tell them about the digital stuff because we assume that we can't use them. And then if we're talking to younger people, which the 0 to 19 teams are going to be, because it's, you know, people that have got younger children, just assuming that because they're younger, they're going to have access and they're going to have those skills. And, you know, just opening people's eyes to the fact that it's not as straightforward as that, and that there are actually a lot of younger people who are digitally excluded. Helping people to see things differently in that way, I think, is really useful.
Thank you. Any final comments from anybody?
No. Okay. So
when people are ready, can obviously got 5 minutes left. You can join any one of the other sessions or head back into the main hall. But thank you ever so much, Amy, for your time. That's been really insightful. Thank you.
No problem. Okay, thank you.
Cheers. Thanks everyone.